One of the hardest parts of living with depression is knowing how to talk about it with your friends and family. All too often, people are met with anecdotes like, you just need to relax, or it's all in your head, which often makes them feel worse. In this episode, we're going to discuss how to talk about depression in a way that helps important people in your life better understand the struggles of living with depression. Stick around. Hey guys, my name is Dr. Brendan Rowe, and this is Real Talk Mental Health in Vancouver, Washington, where we talk about real mental health issues from the provider's perspective. This is our 7th video, so make sure to check out our other videos and click that subscribe button and notification bell if you want to be updated when we come out with a new video. Today, I'm going to discuss ways you can talk about your depression. Talking about depression can be healthy and even liberating. Depression thrives in secrecy, festers in the shadows, like a sliver you don't remove. I find that the more you talk about it, the easier it becomes to deal with it. Talking about it helps reduce stigma all around and makes it easier for other people to talk about it too. Very few people know how to talk about it in a constructive way, so great job on researching how to do that. I often hear from my patients that are dealing with depression that when they try to explain to their friends and family what they feel, they're met with advice and opinions that don't really reflect the severity of their depressive symptoms. This often causes my patients to feel even worse. This is what I tell my patients who are dealing with that. I let them know that they should acknowledge that those people are trying to be helpful, but they might not know how to give advice for this particular issue. I tell them to let those individuals know you're grateful for their advice, but that this is a problem that's not getting better, and that you would really appreciate their love and support as you try to solve it. Explain that you know what it's like to feel down, but what you're feeling goes beyond that. Let them know that you're getting help from professionals or that you're planning to, because that's what people do when they have medical illness. It's helpful to remember that when talking about depression, it's a common and serious medical illness that affects how you think, feel, and act. Millions of people deal with depression every year, so it's important to remember that you're not alone. Despite this, I hear people, well-educated people, sometimes even those in the medical field, talk about how receiving treatment for depression makes them feel weak, or that they should be able to manage it on their own. I hear, I shouldn't need medication to handle my mood, or why should I pay someone to listen to my problems? You wouldn't tell a friend who has high blood pressure or diabetes that they should just snap out of it, but sometimes we tell that to ourselves about depression. Sure, there's things we can do, lifestyle changes we can make to improve our symptoms, but those changes do not usually resolve the problem on their own. Compare it to diabetes. This can be managed with diet and exercise changes too, but most people require a combination of lifestyle changes and medication and other treatments for a successful recovery. Everyone has times in their life when they experience sadness. This is a normal human experience. But depression goes so far beyond this, and being able to point that out would be helpful when you're explaining it to others. The reality is that depression is a complicated medical state that might include sadness, but also neurological and behavioral changes that when that persists for over 2 weeks, a diagnosis of depression comes in. Specific symptoms include depressed mood, most of the day, recurring thoughts of death or like life isn't worth living, changes to appetite, feeling worthless, or excessive guilt. Depression is a medical condition that originates in the brain, just like other conditions have their origins in other organ systems. Educating ourselves and others about what is happening in the brain helps us accept the biological basis of this disease. For instance, there's a decrease of activity in the frontal lobe of the brain. That's the part necessary for executive functions such as decision-making, focus, and multitasking. Depressed brains also have differences in how the pituitary gland and hypothalamus respond to hormone stimulation. Just like other diseases, depression does not have a single cause. It can be triggered by a life crisis or a trauma, physical illness, brain changes, genetics, or can occur spontaneously. Often, it's a combination of factors. Depression is not unique or ambiguous in this way. Most chronic illnesses have complex causes. If this is something that you've been dealing with and you're ready to seek help, please reach out to your local mental health professional. Meeting with a therapist can really help you to understand your own depression and all the components of it, then help you to articulate how you're feeling to your friends and family. If you're in the Vancouver, Washington, or Portland, Oregon area, reach out to us. We'd love to help you and be a part of your team. Ongoing support is necessary to overcome depression. It's not a weakness to ask for help, whether it's for depression, diabetes, or any illness. Every major athlete has a team of support to help keep them at the top of their game. Dealing with depression is no different. Thanks for watching, and we'll see you at the next video.